Good afternoon, and thank you for joining us today. Today I'll be joined by Dr. Alex B. with the Office of Public Health. He will make some remarks later on and answer your questions as well. So getting right into the numbers today, we reported 1,165 new cases of COVID across the state. That was on 20,631 tests. Since our last press conference, we've now surpassed 1.5 million total tests, and you'll see that we're at 133,125 total cases. You might remember that yesterday there was a lower number of cases reported than we've been seeing for quite some time, and also a lower number of tests that were reported. And I think Dr. B will address that when he comes up and can answer any questions you might have about that. Today we are also sadly reporting 26 new deaths, so we're at 4,195. Tragically yesterday, one of those deaths was the fourth child in Louisiana to die of multisystem inflammatory syndrome. This is a condition that is associated with COVID, and I know that there's some debate in the medical community about whether this just is one manifestation of COVID in children or whether it's just something that's related. Either way, it's tragic. It's a very serious condition, and it's thankfully a rare condition. But it has impacted 44 children across the state thus far, and as I mentioned, yesterday we had our fourth who actually died from that condition. So I would ask all the people across Louisiana to pray for the parents and the families of those four children. In just a moment, Dr. B is going to come up and give more information on what that condition actually is. Today we have 1,338 patients hospitalized across the state of Louisiana with COVID-19. The good news, that's down 44 from yesterday, and just a little over 2 weeks ago we were at 1,600. So that was July the 27th. So we're down 262 since then, and the reason I picked 1,600 is that in our second surge, that was the low point. I'm sorry, the high point that we got to was 1,600. So we're 262 fewer than that. That's slow and steady progress over the last 16 days or so, I'm sorry, the last 2 weeks. And I'll note that the decline from the 1,600 level actually started 16 days after the mask mandate and the bar closures and the reduced social gathering size. I will tell you there's still a lot of stress on our hospitals across the state of Louisiana, even at that number we're at today. And the stress is both as it relates to bed availability and to staffing. We have 15 hospitals across the state of Louisiana reporting no ICU bed availability today. That's better than where we were a week ago when we had 28. But it's still a very serious situation, and it doesn't just impact the ability of the hospitals to deliver care for COVID patients, but for any patient who might need that ICU bed. There's also a smaller number of hospitals that are reporting that they don't have any med-surg beds as well. And then on the staffing side, there are certainly challenges, not the least of which are posed by COVID directly. The community spread of COVID has meant that more doctors and nurses and other healthcare professionals are contracting the disease, and then they're not available to work for some period of time, and that puts a further strain on staffing, especially when you have elevated inpatient levels in the hospitals. So we're still in a very difficult place, but our trends have been positive over the last couple of weeks. And the progress hasn't been dramatic, but it has been steady. And what I will tell everyone is We owe that progress to the fact that we have more adherence to the mitigation measures. We have more people wearing masks, staying home when they're sick, social distancing when they're out, making sure that they're washing their hands and so forth. Obviously, the degree to which we can get more adherence to these restrictions and mitigation measures will actually show more progress. So we still have some work to do. I would remind everybody we all have a role to play, and it's important that you play those. And this is especially true because we are now opening our K through 12 schools and our college campuses. And so we're going to be bringing more people into contact with one another. So the way we can do this safely, preserve our capacity to deliver health care in our hospitals and so forth, is by everybody doing their part. We are continuing to perform a lot of tests in Louisiana. That's a good thing. Thus far in August, we're at 226,321 tests. We are also seeing turnaround times at in-state labs decrease, which is also a good thing. And there are some indications that out-of-state commercial labs are also starting to turn those tests around a little bit quicker. All of these are very, very positive to report, but we still have some ways to go because the sooner we know someone's positive and get them into isolation, the fewer people they're going to make contact with. And it also gives us an opportunity to contact them sooner and figure out who those close contacts were during that period when they were contagious. And it just makes all of the mitigation efforts around contact tracing much more effective. As a reminder, if you are in quarantine because you've been a close contact with someone who has contracted COVID-19, you cannot test yourself out of quarantine by testing negative. You can test, but if you're negative, you still have to wait that full 14 days in order to make sure that you don't become infected and not only infected but infectious and start getting around other individuals. New COVID-19 test sites have been added in New Orleans, so you can go to doineedacovid19test.com. That's doineedacovid19test.com to find the nearest site and sign up. If you have symptoms, if you've been exposed to someone with COVID-19, if you've been in large groups and weren't able to socially distance, you need to get tested. So contact your doctor or go to your local clinic. You can call 211 as well to figure out what the best place is for you to get tested. So at this time, I'm going to ask Dr. Bu to come up and give remarks. I'll ask you again, if you have questions for him, please ask them at the conclusion of his remarks. And when he is done, I will come back up in order to complete my remarks and then take your questions. Thank you.
Thank you, Governor. Thank you all. So as the Governor noted, I did want to spend a little bit of time today